So I'm going to talk about mental health disparities amongst African Americans in the US. So African Americans make up 13.3% of the US population, and African American communities across the US are culturally diverse. About 27% of African Americans live below the poverty level, compared to about 10.8% of non Hispanic whites. Um, so the population distribution of Black Americans is as seen. Most live in the South, with the least or the smallest population density in the Pacific Northwest, all the way down to Arizona and New Mexico. So the mental health status, African Americans often receive poor quality of care and lack access to culturally competent care. Only 1 in 3 African Americans who need mental health care receives it. Compared with non-Hispanic whites, African Americans with any mental illness have lower rates of any mental health service use, including prescription medications and outpatient services, but higher use of inpatient services. Some of the disparities. So, compared with whites, African Americans are less likely to receive guideline consistent care and less frequently included in research. Compared with the general population, African Americans are less likely to be offered either evidence based medication therapy or psychotherapy. And compared with whites with the same symptoms, African Americans are more frequently diagnosed with schizophrenia and less frequently diagnosed with mood disorders. Differences in how African Americans express symptoms of emotional distress may contribute to this misdiagnosis. Black people with mental health conditions, particularly schizophrenia, bipolar disorders, and other psychoses, are more likely to be incarcerated than people of other races. It's also interesting to note that they're more likely to use emergency rooms or primary care facilities rather than mental health specialists. So some of the barriers include a stigma associated with mental illness. This is probably due to a general distrust that they have towards healthcare providers. This can be related to the study that was done in the late 1900s with the Tuskegee Airmen when they were testing syphilis. There's also a lack of providers from diverse racial and ethnic backgrounds. And many providers are also culturally incompetent. And finally, a big barrier is the fact that many African Americans are uninsured. And so, with all these barriers, we need to really focus on removing them and helping African Americans get access to better mental health care so that they can truly reap the benefits and we can see a higher use and an increase in trust and a decrease in the stigma associated with mental health.